Hi everyone, this is Juan from the Insurance Guys. So I'm sure you have a lot of questions and confusion about how the medical card works. So I'll be explaining the 4 major points so you have better clarity. After these 4 points, if you still don't understand anything, you may contact me or us and we'll leave a contact number down below. So for the medical card, I will be explaining about individual medical card which you purchase yourself, not the one provided by the company, because the one provided by the company have different terms and conditions. So I'll start with the first point, which is what is covered. So what's covered is all admissions and surgery. Okay, I'll put a tick here so it indicates that it's covered. So there are 4 exceptions to this. So first is pregnancy and pregnancy related illness. Second is mental illness. So if there's an admission because of bipolar or depression, this is not claimable. Third, dental, and fourth, cosmetic procedure. So for dental and cosmetic procedure in general is not covered. So for example, dental, if I have like a root canal problem and I need to extract the tooth, and so this is not covered. But if I fall down and chip my tooth and I need to repair it at the dentist, so this will be claimable. Similar to cosmetic procedure, so any beautification, this is not claimable. But if let's say I'm cooking and then there's a scalding by oil or hot water and I need to get the skin lasered back, this is claimable. So I'll write the note here, can be claimed if accident, and the same goes to cosmetic procedures. Alright, so second, what's not covered? Outpatient treatment, outpatient consultation or treatment, whether to the clinic or specialist. Alright. Of course, there are exceptions when it can be claimed. So the first would be pre and post hospitalization. So what's pre and post hospitalization? I'll give you an example. If I go to the clinic for a fever and the doctor prescribes me with some medicines, right? And then I go home, I take the medication and I'm cured. So because it's purely outpatient, it's not claimable. But what if even after the clinic visit, I don't feel well and I suspect maybe there's something more serious? I go to the hospital, get a blood test, and it turns out that I have dengue. So I need to be admitted for dengue. If I'm admitted for dengue, I'll be covered under number 1 because I have an admission already. So how about the clinic visit earlier? Now it can also be claimed as part of a pre-hospitalization consultation. And after I'm discharged from the hospital, any follow-up can also be claimed as post-hospitalization. So this will typically range between 60 days before hospitalization and 120 to 150 days post-hospitalization. Okay. Second is accidents. So accidents can be claimed even though it's a minor accident. So if let's say when cooking I have a cut and then I need to go to the clinic to get bandage, ointment and painkillers, so I can claim because it's an accident. If there's a more serious accident that requires surgery or admission, of course it'll be covered under number 1. But even minor ones are claimable if you go to the clinic. Third is kidney dialysis is claimable, and outpatient cancer like radiotherapy, chemotherapy, even though it's outpatient, it's also claimable. So going to the third point, waiting period. So waiting period is a period where the person is not able to claim yet when they just purchased the insurance policy. Why is that? It's to avoid any abuse. If, for example, someone signs up for an insurance policy and they did not declare any pre-existing illness, and then they take up the insurance and they want to claim straight away. So there are controls by the insurance company to avoid this happening. So it's divided into 3 categories. So the first is accidents. So accidents there's no waiting period. From day one, it's covered. Because there's no pre-existing accidents, it can suddenly happen. Second is diseases like viral fever, bacterial fever, dengue, COVID. So the waiting period for this is 30 days. So if the person takes up an insurance policy today, after 1 month, should the person get any sort of communicable disease, this is already claimable. Third is others. So there's a list of things that I'll categorize as others. The list is quite lengthy, so I'll just summarize it here, and I'll give the attachment in the video description. So for others, it's something that's not accidental, not disease. So basically anything that arises from our own body due to our diet or genetics, right? For example, like diabetes, heart disease, etc. So this is 120 days, so about 4 months. So after 4 months, these are already claimable. Finally, how to claim. So there are two ways. There are two ways to claim. First is cashless via guarantee letter. So how this works is, if we need to be admitted to the hospital will fill up a form and request to the insurance company, whether it's AIA, Great Eastern, Prudential, to get a guarantee letter from the insurance company. So once the insurance company has received the form, they will take about 1 to 2 hours to reply with a guarantee letter. If the guarantee letter is approved, that means the insurance company will guarantee any expenses incurred by the patient at the hospital. So that's why it's called a guarantee letter. Secondly will be reimbursement, pay and claim. This means that the person has to pay first and submit a claim later on. Alright, so what would be a claim under reimbursement? The first will be number 2 under exception. Except for outpatient cancer. So number 2 exception, so these items are reimbursements, okay? It cannot be covered under the guarantee letter. The patient has to pay first and then submit a claim. So the agent can help on this. For outpatient cancer, GL can already be issued. Second is non-panel hospitals. So for example, government hospitals or a few non-panel private hospitals as well. Maybe they just haven't submitted to be a panel with AIA yet, or the respective insurance companies. This can still be claimed, but it'll be on a reimbursement basis. Third will be 3A and 3B when policy is less than 90 days old. So 3A and 3B, accidents and disease. So I mentioned earlier that accidents from day 1, it can already be claimable, and diseases after 1 month, it can already be claimed. But if the claim happens when the policy is not yet 3 months old or 90 days old, it can be claimed via reimbursement, not guarantee letter yet. After 90 days, no problem, guarantee letter can be issued. Third is 3C, when policy is less than 2 years old. So this is a bit longer. So 3C is others. So let's say I have a heart problem after 5 months taking up the insurance policy. So 5 months is 150 days. So I can claim already. But because my policy is less than 2 years old, the insurance company needs to verify that indeed I did not have the health condition before taking up the insurance policy. So that's why it's on a reimbursement basis, and then it will be reimbursed back to the customer. So after 2 years, no problem, guarantee letter can already be issued. So I hope this clarifies number 1 to number 4, and like I said, this is not unique only to AIA, it's to all insurance companies if you take the policy individually, meaning not from your employer's group insurance coverage. So I'll also attach the notes in the video description. So hopefully this clarifies things, and any questions, just contact us. All right, take care.